I literally can forget things that happen. And I was fully there when you told me. I was as present could be. I'm a former therapist, for crying out loud, but I don't take progress notes on conversations with friends.
That one got Aaron.
You don't? I do. I do that with all my friends, right? No,
Aaron's got it. Aaron has had a notebook out since we first met.
You got something going on with your hair there, Stephen. I'm not quite sure what to think about it, but there's definitely something going on.
I appreciate it. That's the first sort of like,
it's got personality.
That's the first sort of like mixed compliment I've gotten about my hair in a long time. I needed that ego crusher.
Oh.
You know what I mean?
Oh, I can hit it harder if you want, but
Are you okay, Stephen? Is everything all right? I don't know. Your hair's telling a story here.
Okay, the back of my head isn't even dry. Okay, so we're even here. Okay.
Actually, ditto. Lest we turn around.
Okay, who has pants on? Okay, and then we'll move on.
I think this tees us up perfectly because we're going to be talking a little bit about masking today.
Hey!
So Aaron's the designated grown-up here. Okay, all right, I feel you. It's necessary.
Oh, was that not clear? Was that not clear? But you be careful though. You scratch beneath that surface just a little bit, and that radical justice-seeking warrior comes out. It's just right there under the surface. Speaking of masking, today we are super excited to have Diann Wingert on the show. She is a former psychotherapist, serial business owner, and coach who helps neurodivergent entrepreneurs focus, follow through, and finish what they start. She emphasizes leveraging their ADHD as a business asset and is passionate about neurodivergent individuals achieving financial independence through entrepreneurship. She also hosts the ADHD-ish podcast, is a practicing Buddhist. Diann, you're here. Welcome to Attention Different. Let's start things off. Aaron, I think you've got our first question. We're thrilled.
We met years ago at the Atlanta CHAD conference, which is now the International ADHD Conference. And you had come to one of our presentations, our lectures there. And we wanted to, because we realized at that time when we met that we shared a lot of common values in the way that we frame ADHD, the way we see ADHD, in terms of radical acceptance and how people mask it and how we look at things in a more, uplifting, strength-based lens. But I wanted to just get some more of your thoughts on kind of like that genesis story of where you and us, like Attention Different, met and how your life, because you transitioned from being a psychotherapist and clinical practitioner to launching your own coaching practice and podcast and diving deep into the ADHD coaching world. So I wanted to get you to speak a little bit more on that, on those tenets of our kind of some of those shared overlaps in philosophy and approach to ADHD.
Well, at the risk of sounding like a big old hypocrite, I think I was reluctant to drink the Kool-Aid for probably a little bit too long. And I'll tell you what I mean by that. My oldest child was identified as ADHD when he was 8 years old. And because I was completely unprepared for that, in true ADHD fashion, I started doing the deep dive, learned everything I could about it. And at that time, that was in the early 90s, only little boys were being identified. And the thinking at the time was, by all the pundits, was that they would outgrow it by early adulthood. Well, I got
literally told to me, yes, ma'am.
Yes. So I got so involved with what I was learning that I decided I'm going to give up my well-paying career in medical sales, and I'm going to go back to grad school in social work and become part of the lowest paid master's degree on the planet, because I was so obsessed with the idea that there have to be other families like ours who need specialized help. Well, guess what? Here I am in grad school. I'm at UCLA in the Neuropsychiatric Institute, which is extremely well respected then and now. And so all of my professors, all of my preceptors, all of my supervisors were telling me, you help these young boys, you're going to change their lives because they're going to outgrow this. They're going to go on with it. Well, guess what? I'm running a social skills support group in the evenings with a bunch of little boys. I had a co-facilitator who was neurotypical, completely horrified every single meeting. He sat at the other end of the table and did absolutely nothing while I'm running the show. It was like a 3-ring freaking circus. So then comes time for the group to wrap up. And you can picture this, right, Aaron? Because you're a clinician, you know.
Very.
Sometimes,
right. Of course. I was just going to say, yeah.
Yeah. Sometimes they partner you with someone who's not as well prepared for the task, thinking that you're going to mentor them and they're going to come along. I think he was totally traumatized. I'm not even sure he stayed in the field. Anyway, after the groups ended each week, I walked those little boys out to the waiting area where they would be picked up largely by their daddies, because usually there's more than one kid in a family, at least at that time. And the other kids were home with mom. So dad is tasked with picking up the kids. So I'm meeting these dads and I want to tell them what we did and how they might continue those lessons at home that we worked on in the group, so that there would be a carryover effect. And even if they were lucky, they could share them with the kid's teacher. I'm meeting dad after dad after dad. And now you guys know exactly where this is going, right? And I'm thinking, you know what? I may be wrong. I'm just a lowly grad student, but I don't think any of these guys has outgrown these ADHD traits. What I also noticed is that probably half of them were continuing to struggle in many areas of their life.
Oh, yeah.
And others were literally like they were succeeding on every level. So I thought two things. One, what if this isn't outgrown? And two, what are the differentiators between those who struggle and those who thrive? Well, guess what? What do? I approach my preceptors and say, this is what I want to do my master's thesis on. I don't think that ADHD is outgrown. And I think there's something that we don't understand about who does well with this condition and who doesn't. Then they thought, sure, knock yourself out. You're going to fall on your face and come crawling back and asking for another topic in weeks.
And this was what year? Around what year?
This was 1994. 1994, okay. Right?
We're going to come back to this, but this is so precious.
Oh, yeah.
Go on. Yeah.
Just for those listening, the adult ADHD, like ADHD in adulthood, and by the way, we know there's no adult onset ADHD. If you have it as an adult, you've always had it. You just might have been not picked up for many reasons. Anyway, ADHD does not make it into the adult section of the psychiatric manual until 10 years after, right? In the early 2000s. So I go ahead and publish my research. I get my degree. And in true ADHD fashion, I go on with my life and forget all about ADHD for a while.
Oh my God.
I could have been the grandmother of adult ADHD, guys. You realize?
You could have been Brene Brown. You could have been Brene.
What a missed opportunity. But, I go on with my career then later on.
But you probably weren't being supported either, right? It sounds like there was a lot of resistance
not at all.
you're meeting up against.
No, but it's, what's so true about this is that how many of us have among our ADHD traits the ability to, I wouldn't say predict the future, but recognize things before other people do. And then when we say, hey, am I the only one here that didn't notice that the emperor has no clothes, or notice that the emperor has no clothes? And people, you're like, okay, freak, whatever. But years later, they're all figuring it out and probably taking credit for it, even though they heard it from you much sooner than they were ready to hear it. So that was one of many, many experiences. By the time I met you, I had been a psychotherapist in a variety of different settings. I'd been a professor of social work. I had trained hundreds of people to go into the field and eventually ended up in private practice. By the time I got officially diagnosed with ADHD by a child psychiatrist, I was well into midlife, probably not the oldest person that's ever been diagnosed, but I got two outcomes. The child psychiatrist who diagnosed me said, you are a classic case of a combined type woman with high ability combined type. And we can come back to that if you want to.
Surprising. Oh, yeah.
So I outed myself by joining a ADHD psychoeducational support group. And what do I get? Instead of being clasped to the bosom of all my brethren, welcome to the family. You certainly have come late to the ADHD party, but boy, are we glad you're here. I have people DMing me inside the group saying, you really aren't, are you? Or I got it. you're a journalist doing a piece on adult ADHD. You're here for research,
people thought you were conspiring in some way, like to
like they didn't believe your presence. Like,
so when I met you, so when I met you, it was the first ADHD conference I had come to. And if you need proof that I actually am ADHD, I was a day late because I missed my flight because I was talking to somebody about my new diagnosis.
Classic. So this was in Atlanta. Yeah, this was in Atlanta. Mm-hmm. What was it, 2007?
17.
Or 17, yeah. What am I saying? 17. Yeah.
Your approach, first of all, when I saw attention different, I'm like, say more. Because I don't like that this is called I'm okay with difference. It clearly is a difference. I don't like disorder. I don't like deficit. Because I think a lot of people, when they hear those words and all the words that go with them, they immediately start reducing their expectations for themselves.
Yeah.
And that is so damaging in so many levels that instead of thinking, what do I need to work with the brain I've got instead of the one I thought I had or should have had, or people are telling me I should have, what works for me? So we turn on that natural ADHD curiosity. And instead of trying to prove people wrong or mask and hide for approval, we say, what works for me? And I just don't think that's the conversation enough people are having, but we are.
Yeah. A lot of people are having the opposite conversation of like, what's wrong with me, right? Why can't I?
Sorry to beat the dead horse, right? To double down, but it's also external as well. I found that my distaste for the label is that it teaches others how to treat you and to think about you as much as it teaches you. So then there's this feedback loop, and there are confirmation cycles where somebody who has more of a negative or punitive relationship to you in terms of your ADHD rather than supportive or endorsing or encouraging, they will leverage disorder and deficit just as much as your shame will. Right. So that confirmation externally it's just a doubling effect, a tripling effect, I find. The label sucks.
We need a rebrand. ADHD needs a massive rebrand.
Hey, Stephen here. Sorry to interrupt. We just wanted to take a brief moment to tell you about this week's sponsor. At Attention Different, our mission is simple. Offer ADHD adults proven practical strategies for living a more balanced, fulfilled ADHD life. And that is why we are thrilled to offer our latest course, Thriving with Adult ADHD. While other courses might focus on the pain and struggle of being an adult with ADHD, and we do not want to minimize that, this course is designed around accessible, relevant, and applicable techniques that address the most common challenges facing ADHD adults. Inside Thriving with Adult ADHD, you will learn how to get organized by building routines and habits to bring structure to your days. You'll learn to find balance by optimizing medication, self-care, and professional support. You'll learn how to gain confidence and take control of your life through tailored, actionable solutions. Thriving with Adult ADHD features 2 hours of on-demand video, 10 downloadable resources, lifetime access to the material, and a satisfaction guarantee. Go to attentiondifferent.com/thriving to sign up now. That's attentiondifferent.com/thriving to sign up now. Hey, thanks for the quick break. Now back to the interview.
You came to our Atlanta lecture, and for the record, Aaron and I just recently went back to review some of this footage because our in-house editors and social media captains have been pulling from our past lectures and keynotes. In going back to our past work, there's always that, like, am I gonna like what I said? Am I gonna like the way I said it? We're such perfectionists that we can do that in reverse as much as we can do it now. But in fact, the opposite has been happening. Really encouraging. We were kind of digging it. Like, we're still saying there was something so refreshing to hear us saying in arguably more ferocious and poetic ways then. A lot of the stuff we still say right now. We still stand by a majority of what we presented, and it was very creative and unique. And we're curious, it sounds like our planets and stars were aligning with yours, as well as a number of other of our contemporaries and peers in the ADHD conference circuit at that time.
You gave us an experience, okay? And I think if I know one thing about ADHD, folks with ADHD, and I know quite a few things about them, as do you, I know that we do not tend to be as receptive to what we might call traditional learning environments, where you sit down, shut up, keep your hands to yourself, and listen. Pay attention all the way to the end, like the good little angel that you've never been. But you gave us an experience. You gave us an interactive workshop, and you brought in certain cultural elements that I think a lot of people there related to. For example, the red pill, blue pill thing.
From the Matrix, yeah.
Yes. Like who among us does not think about our brain working more like a matrix than the yellow brick road, right? Like we're nonlinear. Yeah. It's more of a systems kind of concept. And when you gave people the opportunity to take the pill to be without their ADHD or take the pill to keep it, that is such an empowering experience, because we can talk about, oh, what would it have been like if I had been diagnosed earlier, or what would it have been like if I hadn't experienced so much shame, or who would I have been if I had unmasked myself at an earlier age and stage. But the only question that really matters is, would you choose this if you could? Because it forces you to think, yeah, for all the struggles and for all the cringe moments and for all the embarrassment and the shame and inconvenience and, you know, late bills and all that, are there things about this that serve me and make me who I am in a way that I feel unique and proud? And I think it's such an invitation that I would still answer the same way today.
And your answer was, and still is, what?
I would keep my ADHD. Now, I have to be transparent and say I have a lot of privilege.
Right.
You know, I'm white. I grew up at a time where, in a place where there were resources available to me and my family to be diagnosed, to receive treatment, to go to therapy, to afford coaching. And also I'm also gifted. So I think the people that I've met that are gifted in ADHD, which is sometimes referred to as twice exceptional, tend to perceive their ADHD as less of a detriment, because we sometimes fail our way to success because we try things, and when they don't work out, we think, all right, what can I try differently? I think less often than, well, I knew that wasn't going to work, I'm a loser.
In some ways, the strengths and capacities people have, if they're twice exceptional, they can counteract some of the severity of the symptom presentation that other folks may have who have a little bit harder time living in their own brain. So we have to be like sensitive to that, you know, not everybody is saying, I can get to the place where I'm accepting this condition. I also think that like it's a process, right? I mean, you mentioned that you have kind of a Buddhist philosophy around this, and I think Stephen and I have, you know, some tenets of Buddhism that we hold dear to the framework of this company and in our own ethos. And Buddhism is all about accepting the reality as it is, not how we'd want it to be, but as it is. And that doesn't mean that acceptance, right, does not mean, hey, we love every aspect of this and it's all gravy. It's not. It means that, yeah, there's the good, there's the bad, there's the everything in between. And can we come to terms with what that is in this present moment? And I think as someone who was diagnosed later in life, and we see a lot of this with females who are diagnosed later, have internalized a lot of that shame and self-deprecating kind of sentiments. It becomes harder. That I think that curve of acceptance is harder to get over for a lot of folks. And I know you work with a lot of women with ADHD. So can you speak to that too, of like what have you seen about that journey, of that arc of acceptance?
Yeah, that's a really, really good question. Very nuanced. You know, I was working exclusively with female entrepreneurs with ADHD until about a year ago. And I kind of rebranded the company. And now I proudly work with people of all genders, because I realized it's the way I look at the intersection of entrepreneurship and ADHD. It's the way I bring together the fact that I've owned multiple companies and been a licensed psychotherapist and a certified coach. It's just how my systems thinking brain brings all those things together. And so over the years, I would get DMs and emails from people saying, you're definitely the person I'd like to work with. I really like your philosophy about this. Would you please consider working with me? I'm really sorry, but I'm a man. So I'm like, you should never apologize. I realized my branding was so strongly calling out to only women that men who identified with the way I think and the way I coach felt apologetic. So I took off the female branding. However, I will say to this point, historically, over the last decade, I have worked with more females than males. And what I've seen most of all is we are now at probably a 4 to 5 decade backlog of undiagnosed women. It is not at all unusual. I mean, look, I was just in grad school in the 90s, and that wasn't that long ago. And at that time, all the pundits, and I don't just mean like people who are blowing smoke up their ass. They literally were the highest trained people in the mental health field at that time, were very adamant that this only is true for a small percentage, less than 5% of boys who will outgrow it by late adolescence or early adulthood. Nobody was talking about girls or women. So where we are now is the fastest growing group of people being identified with ADHD are women over 40. And it tends to happen in one of two ways. Either they hit perimenopause or menopause and lose the protective effect of estrogen on dopamine distribution. So they start becoming more symptomatic. And a lot of women think, am I losing my marbles? A lot of women think, am I getting early onset Alzheimer's? So they go to a psychiatrist and find out actually you have ADHD. So what I see is, first of all, you cannot find what you're not looking for. And we have not been looking for ADHD in girls or women for decades. Now we're catching up, but we've got this 5 decades of backlog. So it's not unusual for a woman in her early 40s to get identified either because her symptoms are worse due to perimenopause or because one or more of her children are being identified. Right. And I've known of entire generations of the family because the good doctors know this is largely genetically correlated. So they'll say, well, who did this come from? This side or this side. And they'll say, well, my mom's kind of always been like that. And they're like, oh, grandma, for sure. So there might be a child, a mom, and a grandmother all getting identified and diagnosed and treated within short order. And I am here for it. I'm actually part of a group, your family too. I'm actually part of my
mother and my grandmother, right up the line. Yep. See? And through my diagnosis, to be clear.
That's exact. And this is not at all unusual. Now, what's also true about it, and it's wonderful that so many females are being identified, but the flip side, speaking specifically to your question, Erin, is that is potentially 20, 30, 40, 50 years of life already lived.
Totally.
That had that one piece of information been offered and integrated into how they think, feel, act, decide, organize, could have changed everything. And I think so that's why for so many women, the first thing that they experience is relief because, I'm not a lazy, crazy fuck up. I'm neurobiologically different. And then immediately after that, profound grief because of missed opportunities that we couldn't even begin to speculate about. So getting to acceptance, getting to, wow, so this is who I am and how I am. Would have been nice to know a little sooner. And you can't help but feeling angry. I've also known people whose parents, they were told your child has ADHD when they were young. And the parent chose not to do anything about it and not to tell it. So that's a whole other wax, right?
Yes, that does happen. And we have a confirmed version of that, even in amongst our earliest creators and one of our designers for our branding and logo. Same thing, where mother got a positive screening many, many years for herself and her daughter and did not abide by, didn't listen to either one. And then this person that we know didn't get diagnosed until her 30s. So I have a question, speaking of perimenopause symptoms ADHD. For listeners, could you get a little more specific on some of that Venn diagram, some of that crossover where, I mean, it both sounds like a silver lining. It's one that we wish didn't have to exist because we wish the diagnosis came earlier, but it sounds like it helps get this diagnosis. What are those symptoms? What is that? What are those red flags, if you will?
So this seems to be more, and again, I'm not a researcher, so take this, anecdotally.
No, from your experience. Your professional
experience. From my experience, more people, more women who get, and I prefer the term identified rather than diagnosed, because not everyone who would quote unquote qualify for a diagnosis chooses to get one for all kinds of reasons. But if this is who I am. And I personally think someone can be self-identified and benefit from that identification and learning how to manage their ADHD, even if they choose not to go the official route or medication and so forth.
Right.
To be clear, I was officially diagnosed by a child psychiatrist, and I do take medication, and I find it very helpful, but not everybody wants to go that route. So with perimenopause, and this tends to be affected more by women who are the inattentive distractible subtype, which tends to be more women. So just to clarify, 3 different subtypes. We've got predominantly hyperactive impulsive, that tends to be more males. Predominantly inattentive distractible tends to be more females. And then the combined type, which you'd think would be twice as bad, but actually there seems to be some benefits to having traits from both sides. As in my experience, especially among entrepreneurs, because if you're really, really hyperactive and impulsive, it's really hard to take consistent action at anything because you just keep chasing every shiny new object and you don't plan or think things through. So that tends to be more problematic. The folks on the inattentive distractible subtype, which tends to be more female, they tend to be more anxious, perfectionistic, people-pleasing overthinkers, which means it's harder for them to make decisions, take action, not second guess, not go back and redo it. And so it's harder for them on both the entrepreneurial route and really in any kind of employment because they're spending so much time in their heads trying to avoid making mistakes, trying to get everything right, trying to please everybody, trying to make everything perfect. Trying to mask, trying to hide, really just trying to fly under the radar. But if you're an entrepreneur, flying under the radar is going to mean you're going to be invisible even to the people that you want to hire you. So with perimenopause, that overthinking tendency, that anxiety proneness, that being in the head and less likely to take action and see what happens, that tends to ramp up. And forgetfulness, disorganization, all the things that we're very, familiar with.
Brain fog, fatigue.
Difficulty with sleep. And of course, the hormonal part of that, you're waking up because your hormones are fluctuating. So that a lot of women who've done well enough, they've worked really, really hard to just knuckle down and buckle down and just force themselves to appear as though they don't have any deficits. Once they hit perimenopause and menopause, they feel like there's nowhere to hide anymore. They're completely outing themselves. And it can be really, really scary when they don't realize what's actually going on and what the cause is. So I think it's good that it gets them into a doctor. Right. But what's bad, guys, is that they're more likely to be diagnosed with anxiety or depression than ADHD.
Still getting missed by the
because
doctors.
They're probably not going to go to a psychiatrist. They're probably going to go to their primary care doctor or their OB/GYN, and there still aren't enough of that know. So they're hiding in plain sight, bottom line.
And it's really important point that you're mentioning about getting identified and the difference of like identification and diagnosis, and how to go about that journey. So I think if you're a female, if you're listening to this and you're a female, you're thinking you may have some of these symptoms of perimenopause, I think it's important to know like, hey, there's avenues for you to go and explore this, get some help, but go to a specialist, go to someone that has the experience to be able to like flag this. Don't just go to your primary care. your regular doctor, look for a specialist who knows ADHD, who could recognize ADHD and tease it out from things like anxiety and, adjustment disorder and some of the other things that it might get flagged as. And, I guess the other part of this is, can you speak to how, what people can do and also how these symptoms exacerbate? Because I think what I'm hearing is like, it's almost like they have the underlying ADHD and maybe they've gotten to some way of coping with it, right?
Mm-hmm.
Right.
And then perimenopause adds a whole nother challenge to this, and it just exacerbates those underlying symptoms. So can you kind of like speak to that a little bit too, of like, what is that like? And also, what do people then do like once they realize this?
Well, I always like to say knowledge is power, but I had a barista at a Starbucks once lean over the counter as he heard me saying that to my companion and said, actually, applied knowledge is power. And I said, you are my new best friend. Thank you. Thank you. Thank you. Thank you. And didn't get his name, but I always like to credit that. So applied knowledge is power. And in this scenario, unfortunately, even in these modern times, 2025, as we're recording, there are still plenty of otherwise caring, competent, qualified physicians who think all women approaching menopause are hysterical to some degree. There's that bias and stereotype. So applied knowledge in this context means you do your own homework first and be prepared to advocate for yourself. Because I think, modern medicine, doctors really need to partner with their patients. And if they don't want a well-informed patient who comes in and says, hey, I'm here for my annual checkup, and I think there's something else going on besides the fact that I'm tiptoeing towards menopause. I think oftentimes we have to be the ones to introduce that conversation because there's no screening that's happening. And I think this is especially true for many women who, because of their underlying undiagnosed, unidentified, and untreated ADHD, most definitely have experienced anxiety, depression, sometimes eating disorders, sometimes other types of things, and certainly trauma of all kinds. So it's not that, if your doctor sees, oh, you have a history of anxiety, you have a history of depression, they assume, oh, well, maybe that's just getting worse because now you're hormonal. So they're still not dialed in on the fact that, yes, there can be comorbidity, and that just means you have ADHD and you also have anxiety, or you have ADHD and you also have depression. But they're
occurring at the same time,
co-occurring. However, I think for a significant number of women, that anxiety and that depression is a direct result of the unidentified, unmanaged, untreated ADHD that she has always had. So sometimes, and this is not unusual, when a woman is eventually identified with ADHD and treated properly for her ADHD and her hormonal imbalance, if perimenopause or menopause are on the table, many of these women find their symptoms of anxiety and depression recede and even go away because it's the ADHD that was driving their difficulties with life. That was certainly my case. I had experienced several episodes of major depression, usually around major life events like a divorce or a loss. But once I finally got identified with ADHD and properly treated, I've never experienced or been treated for symptoms of anxiety or depression again.
Wow.
It was the ADHD the whole time. So I think women need to be informed. They need to be prepared to initiate the conversation with the doctor, advocate for themselves with the doctor, and if necessary, change doctors. Because if the doctor insists, well, you've already had anxiety and depression, maybe you just need to have another medication added, or maybe it's this or that. But if you are it's polypharmacy.
It's a pattern we've seen for years. Yeah, polypharmacies.
Yeah. And unfortunately, I don't know if this data is up to date, so forgive me. But a few years ago, I quoted a research study that said 40% of women over 40 who go to see their doctor, regular checkup, are going to leave with a prescription for an antidepressant. 40 over 40. Hello? We can't all be depressed. I mean, so I think that some percentage
or the,
no, but we can be. Okay.
But no, but that 40 over 40 is such an important and impactful number. Aaron and I find that even in 2025, we consistently run into these stats that if you have even a baseline understanding in how statistics and population size and scale and scope works, when you hear 40%, that number should make you gasp. That should make your heart clench. That is so many people at scale.
That's
right?
abnormal.
These percentages, it's abnormal. It's extremely abnormal for that. When you're getting percentages and stats like these over 10, you are talking about massive chunks of humanity inside your country. And I think we tend to forget that because it's 40 over 40. No, that's 40% of women going to get a casual check-in. I think I have a fever, leave with an antidepressant prescription. If that ever was a real reality, like that's insane. That's an abnormal, absurd amount of people leaving with something they did not enter to receive, right? That's
I love that you're a feminist. I love that for all of us.
For the record, I was moved earlier almost to tears when you brought up, I call them the divine feminine, divine masculine representations of ADHD, right? I have always been both. I have always been combined type. I have never been educated on the possibility of a gender spectrum and a sexuality spectrum, et cetera, till very recently. And it now feels pretty fascinating and profound that I have always been a combined type ADHDer and have also always been genderqueer, right? So there is something to this. There is something to this that, and also the people in my life who have ADHD are not men. They are women. It's my sister, my mother, and my Nana, right? So like when you go through the Tonti line, it's the women who have ADHD. It is not the men. So that's stimulated a great internal debate and revelation. And yeah. There you go.
I'm really glad you brought this. I'm glad you brought this up for several reasons. One of them is because anecdotally, and this also relates to why I rebranded my business and my podcast to be available, accessible, and engaging to people of all genders. That was a very intentional choice, and I'm very happy that I made it. I anecdotally have noticed that there seem to be, I don't know what the correlation or causality, like I said, I'm not a scientist, I'm not a researcher, but I've just noticed that the pools of people that are genderqueer and the pools of people that are neurodivergent, there seems to be a pond that has a lot of crossover. And I'm really interested in knowing more about that, like from a neurological and evolutionary perspective. So another conversation for another time.
For our round 2, yes, for our next time on your show.
Oh yeah, actually, I'm going to hit you up for that because that is a conversation I really want to explore, and I think it's a really timely and relevant one for a lot of people.
That was such an important point, and I'm glad we brought that up. And I want to come back to though, because you were about to mention also about what can females who are, cisgender females, what can they do once they have perimenopause symptoms that are presenting? What are some of those steps that are some proactive kind of measures they can do that can help with ADHD and the hormonal changes?
Thank you for dialing the retractable Chihuahua dog leash on my brain. I always think my brain, I have little fluffy dogs, and I always think my brain needs like the 15-foot retractable leash that I use on them because it likes to run, but it needs to be dialed in sometimes. So thank you for reminding me I didn't complete that question. First of all, I want to go back to where I started with, which is to be informed, do your homework, initiate the conversation, be willing to advocate for yourself, and change doctors if necessary. But I want to be really clear. If you're going through perimenopause or menopause, being identified with ADHD at that time is probably going to require that you get your hormones addressed as well. I want to be very clear that it will not be enough to say, oh, I'm going to get identified with ADHD and I'm going to take treatment for ADHD, and that's going to address my perimenopause symptoms. These are two different systems that both affect the body, mind, and brain. One is the endocrine system, which is your hormones, and the other is how the brain actually functions. So most women are going to need, and this is certainly my case, You need to have your hormone levels checked, and you need to have hormonal imbalances addressed. There are a variety of different ways to do that. We're not gynecologists. We're not going to go into them. But getting your hormones addressed probably first will then, and some women believe that they can do that with plants, and some women will do that in a variety of different ways. Most women will choose conventional hormone replacement, and there's lots of different ways that you can do that. But once your hormonal imbalances are addressed, then you can be assessed for what level of impact and impairment your actual ADHD symptoms have. When everything is going on at once, you have untreated hormonal imbalance, you have unidentified, untreated ADHD, it's going to be really hard to know what's what. So in my experience, addressing the hormonal imbalance first will then leave you with, okay, now ADHD is riding along. It actually was here first. The hormonal imbalance came second. But now how do we address that? Some people may be able to do it at the same time. There are very, very few of these physicians out there, but reproductive psychiatry is a very new field. There's just a handful of these specialists. Maybe you could get a consult with one online and then go take that information to your gynecologist. But that seems to be a brand new specialty. And I hope it's one that grows. It seems to be very much needed.
Yeah.
The next thing I want to get into, because we talked about masking, I wanted to talk about that a little bit, because we just came back from this neurodivergence conference, or not just came back, but it's that was our most recent conference we interfaced on. And they did this really interesting exercise there where they had people actually draw their mass. And I loved it. It was very powerful even for me, right? I was thinking, oh, okay, maybe this is just gonna be an artistic endeavor, little activity, icebreaker kind of thing. But people literally drew their mass, what they thought, what they want people to see about themselves, how they present to the world, and then also kind of your core values and how you want to be seen. And it was so powerful because people put these on the wall and tacked them up, and it really moved me. I was in tears doing that exercise. And so I wanted to talk to you about that too. With how do we mask? What do we do as ADHDers? What does masking look like?
Well, that was where we reconnected after it's been, some few years. And I spotted you in the crowd and ambushed you immediately. And that, to your point, I think that exercise was powerful in the same way what initially brought us together at the CHAD conference.
Right.
Because it was an experience. We can go to lectures and listen to people talking about masking, and people listening to this podcast are going to hear me lecture in a way about it. But what made that experience so powerful is it wasn't just a simple art project. It really, it got us to think, it got us to feel, and then it got us to accept the invitation to be vulnerable and share. And what was so amazing to me about that exercise, and I am no artist, that's for sure, but I did it and I thought, wow, I feel exposed even amongst my own kind, which is really kind of ironic, because the first chat, it's like, and I mentioned a few minutes ago when I first got diagnosed and I went into that ADHD psychoeducational support group and people were questioning whether I really had ADHD. I thought, oh my God, it's taken me so many years from first wondering, am I? Even when I did my research in the 90s, there's a section in my thesis called Researcher Bias, where I acknowledged I have a young child with this condition. And I quote, this researcher identifies with many of the same traits. That was so many years before I finally got diagnosed. So I was,
wow.
Right? I was eager to, be with my own kind. I was eager to go to a conference and to be around other people with ADHD. And I was just thinking, this is like literally like coming out of the closet from my queer friends. I'm just going to rip off the mask and this is who I am, this is me, that song on TikTok, everybody promotes with. So, but actually I realized, maybe the mask has grown into my skin a little bit over the years, because there are times even when I try to mask, I feel like it's kind of like, oh, wow, is this really me? So that exercise was a wonderful opportunity to and we didn't put our names on them, as I recall.
Yeah.
But we didn't have to put them up on the wall.
No.
But putting them up on the wall, and I deliberately went and walked by that wall a number of times over the rest of the conference, and I turned over some of them. And what was so fascinating to me and also kind of heartbreaking is how our masks prevent us from showing others who we really are and prevent us from seeing ourselves as we really are and growing into that acceptance. I don't think we can grow in our acceptance while we are masked, because it just doesn't compute. But as I turned over those different masks and seeing how many of them were the same underneath, like the outward facing, some people would like funny, creative, outgoing, high energy, blah, blah, blah. And then how they saw themselves. Like if you went around and turned
they matched.
Them over, I'm like, wow, that so many of us who may look different on the outside actually feel the same on the inside. So masking, there are layers to it. There's the masking that is necessary for safety. Queer people know this. People of color know this. Any kind of hidden disabilities, people who think they have something to hide in some spaces because they're simply not safe. That to me is like the first layer of the mask. It goes along with the term passing. I used to refer to myself as passing for normal, and I thought that was a flex. I apparently was doing it so well that even when I was trying to come out, people are going, no, you're not. Right. So I think the first layer is safety. And honestly, I would be the last person to want to tell anyone who feels they need to mask at least some places for safety. Like, I think that's wisdom. I think that is inner wisdom, and you hold on to that, because safety is obviously the first order need of many needs. But once we've moved beyond safety, masking allows us to fit in, but not belong.
Let's just sit on that for a second.
Yeah, masking allows us to, at least that's what we're going for, to look, to behave, to appear, to signal in ways that other people in that environment will pick up as like, as opposed to unlike. Our brains
pairs with the first one so well.
Our brains are always sorting, right? Our brains are sorting good, bad, right, wrong, safe, unsafe, like me, not like me. And if we are in a survival mode, we are going to just want to stay with things that are like us, because that's what feels safe. So choosing to start to drop the mask a little bit and maybe test people around you for whether or not they can tolerate who you truly are. Something that I work on with, especially when I was working with people who are employed in organizations rather than entrepreneurs, it's like, let's create a opportunity map for you to share some of your ADHD traits with some of the people at work, whether they're colleagues, coworkers, superiors, maybe your boss, without mentioning the words ADHD. And because most people with ADHD are creative and like to creatively problem solve, how could you let people know what you need without telling them your diagnosis? That is one of the ways that you can kind of start to play with the mask a little bit, just to test tolerability, empathy.
Really great advice.
Yeah. But masking is basically covering up, to the best of your ability, the traits that are part of your neurodivergence that you think will either cause you to be rejected, marginalized, criticized, overlooked, or excluded. And sometimes we guess wrong, but once we're masked, it's kind of hard to come out without ruffling a few feathers or unsettling people.
Especially those people that you've had longer relationships with, family, friends, because they know you as a certain way. And then when you start dropping certain masks or revealing parts of yourself that you've not felt comfortable sharing, those people sometimes are like, who is this? I don't know this person. And they might try to push you back into the box or reject you in some ways.
But you're certainly going to hear their myths, misunderstandings, miscommunications, are what I like to call biases and blind spots. Because if you do start to experiment with it, if your goal is radical self-acceptance, if your goal is, I want to deeply accept who I am and how I am, and I'm going to systematically deconstruct this avatar, this persona, this masked man or woman or person that I have become because I thought it was who I needed to be to fit in, but I never really felt I belonged. I'll tell you, and I think I had a pretty good mask game going on for quite some time. I don't ever well, at least I think I did. I honestly do not think I ever truly felt like I belonged anywhere, because in the back of my head was always this notion, but how much would they like you if they knew who you really were? How much would they accept you if they saw you 5 minutes before that meeting or 5 minutes after? And that's really sad to realize how many of us feel that this is a must for us to survive with others, when what it does is it buys you superficial tolerance and the possibility of fitting in at the expense of what makes you most uniquely you. And I think that's tragic.
That was poetry. And I want you to keep unpacking, because I think this is a really profound sentiment.
Here's the thing. Safety, it's like the menopause thing. Deal with the hormones first, then sort out the ADHD. When it comes to masking, deal with safety first. Don't just suddenly decide and then decide, where can I begin to experiment?
Yeah, where and with whom is
where
safe
and
to
with
do
whom,
this.
under what conditions, to get to the point where I am no longer willing to experience shame or be apologetic for who I genuinely am. If I accidentally say or do something that is harmful, I will most certainly recognize it and take, actions to make it okay. When I was masking, I couldn't do that. Why? Because I was so into deep cover that I couldn't even admit that I made the mistake.
Oh my God, such a good point.
So it's like when you're deconstructing who you thought you needed to be, you can be vulnerable enough to say, oh my God, I was going for the laugh, and take responsibility.
But you can only do so because of what you've done.
Yes,
you want
exactly.
to be the person.
I want to be the person who can do that. Let me tell you a quick little story.
Yeah.
We've moved several times in the last several years, and
I'm so sorry for you.
That's not the interesting part. And as a result, I've needed to start to make new friends in new places. I moved to a new place. I'm going to be making new friends, meeting new people. I have an opportunity to let people know who I am and how I am from the jump, and not being who I think I need to be acceptable to them, and then risk, like, I've worked too hard to get to this place. So I recently met a woman that I was talking to, and we really had a great conversation. And she said she had to go. I said, you know what? I like you, and I get the feeling you like me too. Would you like to exchange contact information and connect again for a drink or coffee or whatever? And she said, wow, that's refreshing. Yes, I'd love it. And she later said that was refreshing because nobody does that, because they want to be embarrassed or rejected or whatever. And so we went out and we had our coffee, and I said, hey, listen, there's a couple of things I want you to know before we go any further, because if these are deal breakers for you, it would be better that it happens sooner rather than after we've invested some time getting to know each other and maybe forming some kind of attachment. And I said, I am probably one of the most forgetful people you're ever going to meet. you could literally unload a story about how your mother just passed away or your dog just died or you just got fired from your job. And the next time I see you, I'll be like, hey, how's it popping? And you're going to be like, what is the matter with you? I literally can forget things that happen. And I was fully there when you told me. I was as present could be. I'm a former therapist, for crying out loud, but I don't take progress notes on conversations with friends.
That one got Aaron. That one got Aaron.
You don't? I do. I do that with all my friends, right? No,
Aaron's got it. Aaron has had a notebook out since we first met, taking notes, progress notes. I actually don't pay him, but he is fully my coach.
Yeah, no, and it's if I had somebody following me around like a little note taker, that would be fantastic. But I also said,
that would be so
and
lovely.
here's another thing. I said, I really love owning my own business. I love helping my clients, and I probably hyper focus on it a little bit too much. Chances are, even if I like you just as much as you like me, you're probably going to have to do more of the reaching out to keep things moving. Because I can sometimes get so absorbed in whatever I'm doing that I literally forget everything else. And then I think I told her one more thing. I said, so if any of these make me no longer appealing as a new friend, I get it. I just thought you should know. And she's pulled back and looked at me for the longest time. And it was probably like the longest minute of my life. I'm like, oh God.
Yeah.
Vulnerability hangover. I was like, oh God, why the hell did I say all that? And she said, I not only want to continue, I think I like you twice as much for what you just told me.
Oh.
She says, that is the most genuine, vulnerable, heartfelt approach to a new friendship I think I've ever experienced.
Hell yeah.
I never fucking ever would have had the balls to do that before.
So much courage
Right.
to do what you did.
Right.
But nobody's gonna do this. Like if you're like fully masked and listening to this thinking, oh, nice to be you, lady. This is after a long period of little by little peeling back the layers. And here's what I can tell you. The more unmasked you can safely be, the better the relationships you will find yourself having, including long-term relationships that started off with you masked. Because what could be better than a relationship with who you genuinely are instead of the version of you that's living in fear they're going to find out. Right?
Right. Yeah, because when we reveal those vulnerable parts of ourselves and we do it in an authentic, genuine way, it challenges people to either meet us in that moment, right?
Yeah.
And see us for who we are in the full light of that vulnerability, or to reject us. And it's almost like ripping off a Band-Aid. Like,
yeah,
let's get this over with.
All right. Are you gonna dump me as a friend in a month, 2 months, a year down the line when I do this thing? Or is this something you can handle and see? This is who I am. This is how I show up, and accept me, love me for all the other things. But these things are also things that are part of me. And I'm not intentionally here doing these things. Yeah. Yeah. This is something, what I'm thinking that people might hear this and say, well, is that just an excuse, right? Are you just trying to point to your ADHD and say, well, I have ADHD, so therefore I can be later. I have ADHD, so therefore I don't remember anything that you're saying and I'm distracted. And I think no, it's not an excuse, right? But it's a reason. And if they understand the reason, they know that it's not intentional, they can wrap their head around it and respond very differently. They have a framework to go from.
They can decide.
Yeah, they can. Yeah. Actually, Diann said it, but it's time specific. Diann did something miraculous to this new friend and powerful because at the outset, you gave her the data and you were vulnerable and courageous. At that point, it's a reason. It's not an excuse. It is an excuse a month later when you missed 5 calls or you missed 10 texts and you're like, oh, I didn't tell you, but there's this thing that I have about. Now it gets stored as an excuse in their head. As opposed to at the outset, in the most powerful time and place, Diann said, hey, this is something about my personality. And like you mentioned, you didn't have to say ADHD. All you had to say was, I will probably forget big things you dumped on me 2 weeks ago and ask, how's it poppin', right? That is something about me, right? Didn't have to label it. That is something that you should know about me. It does not mean anything to how much I value this growing friendship, but it is something that I can tend to do. It's a personality quirk of mine. You gave this person the option, as Aaron said, to meet you. And that invitation, I hope people are picking up what we're all putting down. That invitation is so felt and it's so powerful. It's almost tangible at that table. I'm assuming that beat you said of the longest minute of your life, because she was chewing on it. She was processing it. Like, she didn't get this from a lot of people, clearly, this vulnerability, this transparency.
No. In fact, I asked her later, there's a little follow-up story that's really cute. I asked her later, what were you thinking in that moment?
Yes.
Because as soon as I said it, I'm immediately thinking she's probably wishing that she could just like disappear and not have to
disappear poof.
She's probably thinking, how do I tell her to fuck off without not feeling like
within the most polite way possible? Yeah.
Yeah. Or like, are you for real? She said she was literally stunned that I was the way I said it. And who but a little kid is going to say, I like you. Do you like me?
Right.
She said
exactly. Totally.
It was childlike. It was vulnerable. And it showed me who you are as a person. And that is someone who knows who they are and accepts themselves. Why wouldn't I want someone like that for a friend?
In your corner immediately. Yeah.
And it's like, if they like you for who you're presenting to be, which is this masked false self, and you've never shown them really who you are and revealed that, so you don't know, do they really like me for me?
Yes.
Then that's we've lost something really important, which is true acceptance. And I want to read, because we mentioned Brene Brown at the beginning, but I want to bring in a Brene Brown quote because I think it speaks to this moment, to this conversation.
Bring us to a denouement.
True belonging only happens when we present our authentic, imperfect selves to the world. Our sense of belonging can never be greater than our level of self-acceptance.
Yeah, exactly.
And when we accept ourselves, that's when we invite others to see us, right? Because we can't, if we're not accepting ourselves, if we're still in the mass self fully, right? Like you said, sometimes we have to wear those masks in different contexts and situations for protection, for safety. But we shouldn't have to wear those with our intimate partners. We shouldn't have to wear those around some of our closest kin, right? Those folks, if we can't be ourselves and be accepted in those groups, there's something important that's really missing.
That was a really lovely way of saying, like, if you get to that, because you didn't even use the word problem. Like, if you get to a point in your life where the mask, actually, I'm going to take Diann's metaphor. When the mask starts to become your skin, which I think is a very profound and heavy thing you said earlier that I related to. When the mask starts to feel like it's sewn on, a significant, important thing has happened. You have made a very significant choice and you've kept making it every day for a very long time. And it's going to suck to rip the stitches out. But you're going to have to rip the stitches out if you want to feel belonging. I wanted to say a thank you. I wanted to pay gratitude. I think Aaron and I were both deeply moved by this conversation. We're both wiping tears away. We knew that there was some special sauce in this relationship, but I'm really, really excited to keep talking to you, Diann. I think at a personal level, you did that thing that not every guest does. No shame to the other guests. We love all of our guests, but you did that thing that some special guests come on and do, which is like drop 4 or 5 or 6 poetic, distilled nuggets of gold, like real, like experience-based intuition that I think our listeners are going to benefit a great deal from, because those single distilled lines, like I can repeat them to myself like a mantra on a Tuesday, right? And so I'm really thankful for that. You brought the heat. We are so charmed, and I can't wait for the next one. Give us your pluggables. Where can the people find you?
Well, I love to say, if you like the sound of my voice and the things I have to say with it, you should absolutely check out the ADHD-ish podcast. It's available on all the popular podcatchers, that is. And I do some webinars for Attitude magazine several times a year, which are worth checking out.
Cool.
But if you go to my website, you'll find all the things that are interesting to know about me, including if you'd like to work with a like-minded and like-brained entrepreneur coach.
And what's your website again?
Diann Wingert Coaching, but you got to spell Diann with 2 N's and no E's. Diann.
Got it. So Diann Wingert coaching.com.
Bingo.
Thank you so much, Diann. This was awesome, and we can't wait for the next one.